Elizabeth is an orthodontist who limits treatment for TMD. She's lectured extensively around the world. I was lucky enough to hear her speak at the Damon Forum, where she was by far the best speaker. Initially, we had thought of inviting Elizabeth just for a one-day introduction. But the problem with the one-day introduction, it just gives you enough knowledge to then want to know, how do you treat patients? So instead, we've decided to do a 4-day intensive course. From my personal experience, when I went to dental school, our knowledge of TMD was very, very poor. Basically, we were told anyone who has any sort of a jaw problem, you give them a flat plane occlusion splint. We now realise that some patients who have bruxism issues related to sleep apnea don't benefit from a flat plane splint. So in this program, we're going to go through what are the different forms of TMD, what are the diagnostic criteria to get that information, and most importantly, how can you then help the patient to reduce their orofacial pain. That's basically the contents of the lecture, and the big one that is important to me is obviously what component of treatment do you do for a disc that's been displaced for a long period of time. If a disc is being displaced and you are able to recapture the disc, the occlusion will change, and then you need to be able to deal with that, and that's what Dr Menzel discusses really well. But please don't think you need to be fully trained in orthodontics to attend this course. There is a component on how you can work with an orthodontist in the final management of the problem, but that's a very small component. The big component is actually dealing with everyday concerns, talking about the pros and cons of occlusal adjustments, talking about stabilising the long-term outcomes. So I would thoroughly recommend this course. The participants for this course would be anyone basically in the dental profession, and that includes oral health therapists, hygienists, specialists in various forms of treatment of TMD, including maxillofacial surgeons and orthodontists. We're welcoming speech pathologists because of the importance now of oral myology. So it's an open course. We would like everyone to learn. It is limited numbers because we want to make it hands-on, so the earlier you could register, the better.